Welcome to the MSF Frontline Report podcast for the 26th of October 2010. Médecins Sans Frontières, Doctors Without Borders, or MSF, is an independent medical humanitarian aid organisation. I'm Steph Davies. MSF has an established reputation for being able to set up emergency medical programmes in a matter of days, or sometimes even hours. However, very little is known about how and why we leave a project when an emergency is over. The Bon Marché Hospital in Bunia was started by MSF in 2003 after years of conflict and instability had rendered the National Health Service almost non-existent. The majority of local people were not receiving even the most basic healthcare. Although violence between armed groups in the Congo is still a huge concern, the situation in Bunia itself is significantly calmer than it was 7 years ago, and people can move around freely again. Because of this, MSF made the decision to hand medical activities back to the Ministry of Health's General Hospital. MSF's Pete Masters brings us the story about how and why MSF hands over a project.
Bon Marché was huge. With departments covering paediatrics, maternal health, neonatal services and psychosocial care, as well as others, it really became a total replacement health system at a time when fighting in Congo was at its fiercest. MSF opened what was then the Bon Marché Clinic, a 70-bed facility to treat people injured during an intense surge in violence in May 2003. It was the only facility with surgical capacity in the area, and staff were soon conducting about 80 operations per day. Many of the war wounded were children.
It was a hospital that had been in place since 2003 because the hospitals that were already in place were not working. But now, 7 years down the line, I was there to close down the hospital.
That's Kiran Joban-Putra, a British doctor recently returned from Bon Marché Hospital in Bunia.
And we're now in the phase of helping the health structures re-establish themselves.
MSF is still very active elsewhere in the region where the needs are tremendous. But Bunia is in a relatively stable part of eastern Congo. There has not been fighting in the town itself for 3 years now, and people are able to move around freely. After years of Bon Marché being the primary healthcare facility in Bunia, handing over medical activities also meant helping to re-establish and upgrade local healthcare structures.
Bon Marché dealt with the majority of healthcare needs for that population, and so those structures were in no state to welcome all the patients that would have come to them had Bon Marché ceased to exist from one day to the next. I think that MSF felt this was their responsibility.
I asked Mark Dubois, MSF's General Director in London, what this meant.
Kieran's right in a sense. Our responsibility isn't normally to build the system. It's to deliver immediate, life-saving healthcare and to save lives in the present. But as you see in the Bunia area, actually the system became dependent on us being there. And in cases like that, I think we have to consider the consequences of our action. And our action here is closing. We're closing for a very good reason, because we need those resources to be elsewhere where the needs are greater. The situation's calm there now. But that closing has consequences, and so we have to try and make sure that those consequences are mitigated.
I was interested to find out what sort of things would be taken into account to maximise sustainability.
Yeah, sustainability is a tricky word for MSF. I mean, it's not ultimately a goal. The goal of the organization is to save lives and alleviate suffering in the present. But sometimes when you've been in an area for years and years, you don't want to pull out and leave what appears to be nothing behind. What I mean by nothing is you don't leave a system behind. What you leave behind are a lot of people who are alive because you were there. But in some of those situations, what you want to do is be able to make sure that their health care continues, and that means trying to hand over.
As Kiran explained, the process of helping to reinstate and scale up a government hospital in a place such as Bunia, which has endured so many years of chaos, presented three main challenges. The first was the physical capacity of the hospital.
One of the elements of transferring care is building the physical capacity of the hospital, in this case by constructing a new building. We knew that they would need at least 200 beds, because when we transferred paediatrics, which was the sort of final stage of the transfer, we knew that the number of beds in the hospital would nowhere near be sufficient. The hospital had 6 paediatric beds, and we had 200 paediatric patients.
Second was quality of care.
The hospital had not been fully functional for many years. The staff had not been treating children for many years. So this required a long process, several months process of training and of accompanying the staff in the hospital. So we would actually put in a parallel MSF team who didn't substitute for those staff, but who worked side by side with them to train them on the job.
Finally, more patients require more staff to treat them.
So there we had to convince the authorities of the need to increase the number of staff, and this is a process that again took several months, which involved working in collaboration with the authorities to recruit staff.
Even with this level of MSF involvement, however, it will be difficult for the government-run hospital to be able to keep the same standard of care as an MSF-run facility. Lauren Pett, an experienced field volunteer, is now an expert advisor on how to hand over projects in a way that keeps the quality of the medical services as high as possible.
I think it's really important to remember that MSF has quite extensive resources, and when we hand projects over to the Ministry of Health, most of the time they have severe limitations in terms of money and also in terms of staffing and staff training. They also have a different perspective in that they have to provide care for an entire country. That means that the hospital, perhaps that has been receiving €1 million worth of resources and investment from MSF, maybe that million has to spread across 2 or 3 or 4 different districts of the Ministry of Health.
In the process of handing over, teams have to decide what the priorities are. What activities realistically can be run by the Ministry of Health or whoever they are handing over to. And this can require making some very hard choices.
So, for example, we might choose antenatal care or some element of a maternal mortality project, which has very high impact, saves the most lives and has the largest impact perhaps on babies' survival and mother survival, of course. And we might choose that over another activity or another element of the project which perhaps has less impact. And this, of course, is the most painful process for MSF. We're used to being able to give care and give services to everybody in need, but with limited resources we just simply have to choose.
In Bunia, certain neonatal services were the unfortunate victims of the handover process. Kieran explained that the resources needed to treat prematurely born babies, who sometimes need constant treatment for up to 2 months, would not be available in the Bunia General Hospital, and a decision was taken with the hospital to withdraw that particular service. This was a decision almost impossible to make, but one that meant other services could continue and more lives could be saved.
What it came down to in reality for us in the field was ensuring that everybody got seen irrespective of tribal origin, that no one was discriminated against on the basis of ability to pay, and that the mortality rate did not rise beyond a certain threshold which we fixed in collaboration with the Ministry of Health. We've tried to leave Bunia in the best way possible in terms of maximising the possibility of continued high-quality care for as long as possible.
Handing over projects like the one in Bunia can be painful and difficult, but each handover is different. Sometimes another international or local NGO takes over MSF's activities. Sometimes the country's Ministry of Health has been present in the project to begin with, and the handover goes more smoothly. In each case, MSF does the best it can to ensure high-quality care continues. As Bon Marché Hospital closes, MSF teams are assessing the needs of people in crisis all around the world, ready to provide life-saving medical services where they are needed most. And as the size of medical teams in Bunia decrease, new MSF doctors, nurses, surgeons and mental health specialists arrive in projects in Pakistan, Nigeria, Papua New Guinea and Chad.
Throughout eastern Congo and elsewhere in the country where civilians are displaced, suffering from the violence between armed groups, or have little or no access to healthcare, MSF continues to provide medical and mental health care, as well as distributions of relief items. In Haute and Basse-Uele districts in Province Orientale, MSF last year began an emergency response to a dramatic surge in violence. Teams continue to provide free medical health care for the thousands of displaced people and local residents not far from where the conflict is taking place. For more information on the story and to learn more about MSF or Doctors Without Borders, please visit msf.org to find the MSF website in your home country. MSF is an independent medical humanitarian aid organisation that delivers emergency assistance to people affected by wars, epidemics and natural or man-made disasters in more than 60 countries around the world.